Good afternoon, one and all, and welcome to the fifth episode of the Inside Implementation webinar series organized by the Anusthana project at the Institute of Public Health in Bangalore. Today, we are here to discuss the role and contributions of research in tobacco control policy and implementation. In this webinar, specifically, we'll be discussing about how research has played an important role, not only from a sort of an evidence-based perspective, but also influencing policy and practice. Tobacco control research, there's decades worth of tobacco control research sort of highlighting and addressing several factors related to tobacco products, whether it is the health harms related to tobacco, the epidemiology, the social, commercial, and political determinants associated with the product, the sort of tobacco control interventions and strategies, both at the national, subnational, and the district level, and so on and so forth. In the area of policy analysis and implementation per se, in recent times, research has come a long way in sort of strengthening the standards of evidence on what works and trying to understand multiple contextual factors of how tobacco is produced and consumed. And there's a long way to go in understanding these complex conditions. Today, we have with us three speakers who come from sort of the research background and who work closely with tobacco. I will introduce these three speakers. Our first speaker of the day is Dr. Muralidhar Kulkarni. He is the Associate Professor of the Department of Community Medicine, KMC Manipal. He's completed his MBBS and MD, and he teaches MBBS students and postgraduates in MD and PhD. He has been involved in multiple research grants funded by national and international agencies, which include the ICMR, the Government of Karnataka, PATH, USA, Medical Research Council of UK, UK Research and Innovation, etc. He's published multiple research papers in reputed national and international journals, and he's invited to be the academic editor of PLOS ONE journal. He's also been the joint secretary of the Karnataka Association of Community Health and the co-chair for the GACD lung disease program from 2017 to 19. His research interests include epidemiology of non-communicable diseases, tobacco control, and vaccine trials. And particularly, he is the member of the district level coordination committee for tobacco control in Udupi district in Karnataka. Thank you, Dr. Muralidhar, and welcome to the webinar. Our second speaker for today is Dr. Nayanthara Nayak. Dr. Nayanthara is a professor of Center for Multidisciplinary Development Research, CMDR in Dharwad, which is an autonomous non-for-profit research organization affiliated to ICSSR Government of India. She holds a PhD in economics for the thesis Burden of Alcoholism. And she is recognized as a guide for doctoral study in economics from 3 universities in Southern India. She is involved in empirical and action research, capacity building, training, doctoral guidance, and she's part of a research team which carried out a pioneering study in India titled Economics of Shifting from Tobacco. She is a recipient of Tata Postdoc Fellowship at the Institute of Social and Economic Change, Bangalore, for study on community management of irrigation water system. She's received several accolades and has worked in the domain of health, water, rural development related issues through projects funded by Government of Karnataka, Government of India, Ford Foundation, American Cancer Society, Bloomberg Foundation, WHO, IDRC, and so on and so forth. Currently, she is engaged in documenting best practices in alternatives to tobacco farming, evaluation of 24/7 water supply versus intermittent supply, and relationship between COVID-19 pandemic and water access in the Hubli Dharwad city. Welcome, Dr. Nayanthara. Our third speaker for today is Ms. Riddhi D'Souza. Riddhi is a trained lawyer with a keen interest in public health. She is interested in understanding how the state leverages laws and regulations at various levels to respond to the proliferation of harmful commodities like tobacco. How different stakeholders use litigation to negotiate their interests through courts and the relationship between harmful industries and the state, especially in the context of the global south. She has co-authored both academic and policy output papers, evidencing the tactical use of litigation by tobacco industries and how they stall and dismantle health policy in India. Welcome, Riddhi. So to start the webinar, we'll have around 45 minutes of discussion. The format of this webinar is going to be an open, free-flowing conversation with the panelists. And the participants who've joined can sort of, put their questions on the chat box. They can make use of the chat box, and towards the end, can raise their hands and perhaps unmute and ask their questions. So, Dr. Muralidhar, my first question to you is, we know that tobacco is increasing among adults and youth. In Karnataka, it has reduced as per the Global Youth Tobacco Survey, but in some states, there has been a very minimal reduction. In the year 2017-18, you worked on factors associating with tobacco use among school-going adolescents. Could you talk about more about this study and what was the inference of your research?
Thank you, Vivek, and thanks to IPH for giving this opportunity to be a part of this interesting discussion. I hope you are able to hear me.
Yes.
Okay. Tobacco use, as you said rightly, has been on a decline in Karnataka, but the cause of concern is among the females in urban areas. It is reported to be increasing. And as you said, in other parts of the state, there has been a very minimal reduction. So our study in Udupi district, what we had done with the help of the Medical Research Council of UK funding, we did surveys among 6th, 7th, and 8th grade students. And in the next year, that is 2018 and 2019, we did the study among 2000 in the 7th, 8th, and 9th grade. So first year it was 6th, 7th, and 8th, and next year it was in the 7th, 8th, and 9th grade students. So what we observed here is the prevalence of tobacco use as such in terms of ever tobacco use is relatively less compared to other districts of Karnataka and other states of India. So for example, when we did the study here, it was around 3% of tobacco use in the first year and around 2 to 3% in second year. Interesting feature was we found that in a period of 1 year, so 1% of the adolescents are newly experimenting with tobacco products. Now, the district in which it was done is Udupi district, and Udupi district is the high compliance district. So a matter of concern here through the research, what we have found out is a lot of efforts is being put by the government, a lot of efforts is being put by the government officials, policy makers, NGOs, and other medical fraternity in general, if you see, in order to reduce. In spite of that, we are seeing every year 1% of the adolescent are trying and experimenting with tobacco product, which needs to be addressed. So whenever that was one of the findings, we also got some of the interesting findings, some of the best practices, like we have the tobacco-free film rules in our country. So we had also asked students in the survey whether they had seen any films containing tobacco products and what was the impact of that. So we observed that whenever COTPA compliant tobacco-free film rules were present in the films, so that played a good role or attenuation role in preventing the adolescents from trying tobacco products. So this was on the best practice what we found out. And we also observe here that majority of the other factors are common except for these few factors. So one good, two important findings what we extrapolate for further strengthening the tobacco control program is point number one, 1% of adolescents are trying newly. So with all the efforts going on. Secondly, the tobacco-free film rules are some of the best in the country. It is not implemented in many other countries. So whenever we had an opportunity to present in national and international fora, we presented that this is a very cost-effective measure by which we can prevent adolescents from uptake of tobacco. So these were the findings from the study what we did, Vivek.
Thanks, Doctor. Thanks, Dr. Muralidhar. I was just curious, like interested that these findings, how were you able to sort of translate it to actual practice? Because a lot of a lot of scientific research exists on the sort of initiation, on the sort of dual use, and also the on tobacco use experimentation among youth. And since you're working a lot with adolescent and youth at the university level, you've been trying to see this kind of demographic. How do you think should be the ways to sort of sort of translate this kind of knowledge and disseminate it to the actual people who are consuming or are experimenting tobacco use?
Vivek, what we did was we developed policy brief submitted to the state anti-tobacco cell. We also submitted these findings to the National Tobacco Control Cell as well. And secondly, whenever there was an opportunity to present it, I presented these findings in the district level tobacco control committee. And in our study, we also found that those children who were aware about hazards of tobacco and the tobacco control policies were less likely to use any tobacco products. So previously, when I used to go to some teacher training programs, they used to say that the more we tell students about this, the more they're likely to experiment. So with the evidence, what we got, we could clearly demonstrate and convince the teachers that mere giving a lecture is not sufficient. The student should assimilate those points, understand the gravity of the situation. Then only they'll be able to keep themselves off from tobacco use. So the first part of your question, we reached these policymakers across at the district level, at the state level, through committees, policy brief and presentations in the meetings which they call for. And some of the issues we had in our own district, we could inform the teachers that, see, this is the findings what we have got from the study. If their awareness is good enough, no, it's not, then definitely they will keep away from it. So as a result of which, the teachers have also understood it. And whenever we go for any of these awareness program, there is good cooperation. Of course, there is also, we also did a focus group discussion among these students. They also came out with good points, which we are trying to assimilate now, analyze it, and try to further see how we can contribute to strengthening the program.
Thanks, Dr. Muralidhar. I will now ask my next question to Dr. Nayantara. Nayantara, ma'am, your work on tobacco control has focused particularly on the economic aspects, from understanding tobacco-related employment to the challenges in the interface of livelihoods and human rights. Could you shed a little bit more light on your work?
Good afternoon, everyone. Okay.
Hello, ma'am. Yeah, we can.
Can you hear me?
Yes. Yes, ma'am, you're audible.
Okay. So thank you for Dr. Pedra and the IPS team. It's interesting that you are looking into the impact of research on tobacco policies. So coming to my work and your question regarding work. So CMDR, where I'm a faculty, we started almost research maybe 2 decades back. And our first study was an economics of shifting from tobacco, which gained attention of all the researchers across the world and the government of India. And it was later taken as a case study on behalf of government of India and presented in the joint committee meetings all over wherever the meetings were held. So basically, we looked into the economics of tobacco and with respect to other crops also, because a farmer as a rational human being, he was also interested in getting some income. He's doing agriculture because he needs to get some income from the agriculture. So that's the reason we tried to see what are the crops that are grown in tobacco growing region and what are the economics returns from each of the crops. So we compared and see why farmers were growing tobacco. So it's mainly because of economics, that is the returns. But we found that for the first time as a major study that tobacco, there were alternatives to tobacco, particularly in irrigated areas. Sugarcane was the most remunerative crop, and soybean and vegetable crops are near best alternatives. So this was the study, and from there we started with subsidies on tobacco, and later on the air quality monitoring and impact of the CODPA on public places. So the study went on. So that's how we started. And the first study is that it had impact because it was taken as a model and case study by the government of India and for many researchers. And that has been one of the first study in India on the alternatives to tobacco. Of course, the CTRI and individual research have done, but they were not like, they were mostly demonstrative studies, because we did it actually in the farmers fields, discussing with them, and it was the empirical study, whereas others were basically the agriculture crop studies or demonstrative studies. This is one. And did you ask me about tobacco related employment, I think. So this second is not a study. I just we did a rough estimates of tobacco related employment in India. That's basically, if you see the estimates which are available now from the government sources or whatever sources it is available, they say it's almost 46 million dependent employment in India. But that is tobacco dependent employment, including BD rollers, tobacco farmers, tobacco laborers, factory workers, tenderleaf pluckers, so many, the vast employment. But as a student of economics, just anybody, even a common man can understand, whereas tobacco area is just 4.5 lakh hectares. Almost maximum was that much, I think, so 4.6 lakh hectares. So if you take even the maximum, or you take 5 lakh also, 5 lakh hectares, if it is the maximum, it is not recorded. You just see, even if 1 lakh hectare, 1.15 is the average hectare in India, land holding. So if you just divide the 5 lakh or 4.5 by the 1.5 lakh, you will get just 4 point odd farmers. So how can we say that there are 60 lakh farmers in India, tobacco farmers in India? So that is the reason we try to look into that. And our estimates of all this totally shows that around 7.5 million tobacco dependent employment is there in India. It's based on the studies also, Sinley's estimates, Lal and Wilson and CSO and the Euro Monitoring India. So based on that and our own study on 12 states on tobacco farmers, tenderleaf pluckers and BD rollers, we estimated how much the BD rollers roll the BDs, how much tenderleaf pluckers pluck leaves every day, what is the average day of collection. Based on that, we estimated this 7.5 million dependent workers, whereas the current estimates which the government and all the agencies, all the workers, researchers who are doing research, they use is 45.7 million, I think so. That is what they are using it. So I think so. Somebody, I will be happy if somebody looks into this and do estimates on the tobacco employment. Either they can support our estimates, or they can counter check or argue, challenge. So that would be best, because based on this, the government policies is being means planned, because every time you do some tobacco control, there's question of BD rollers, then do pluckers, and farmers comes out. So you should have real estimates, then only government. So that's what government officials and the ministers are asking us. So there is need for again somebody counter checking it and doing a study on how much is the tobacco employment. Of course, mine was one, but I don't find any other studies which have been done on this. So I would be happy on this aspect. So what else? I think so. You asked me about the challenges in shifting from tobacco. There's one paper we did. That is also based on our studies in 12 states and later again in 7 states, and BD rollers, tobacco pluckers, and tobacco farmers. We find that although there are alternatives to tobacco crop in tobacco growing regions, it's not uniform, because each state has the different land, soil conditions. So we find in Bihar, there is no, we couldn't find the best alternative for tobacco, and we couldn't find in AP in some regions best alternative for cigarette tobacco, and in Mysore in Karnataka also there is not a very good alternative to FCB tobacco. Of course, there are ginger, turmeric, they are the crops. But what happens if everybody grows ginger? Then it may not be a best alternative. So there is a need for institutional intervention there. So these alternatives can work when institutional intervention is there, big push intervention by the government, like how it is doing for tobacco. If it does for all these crops alternative, then only we can say as a researcher, see, I am a researcher, I'm not an activist or so even CMDR, what we do the basic research. So it is for the policymakers, for the government, for others to follow it up. So that's what we have given. So these are the challenges. And for BD rollers also, like in MP, there are no alternatives. We couldn't find any alternatives. They are very poor and there are no factories nearby. So there again, intervention is required. Of course, the Labour Ministry is doing some skill development program, but it is like minuscule, like a drop in an ocean. Like it cannot cover all these 3.6 million BD workers. So whatever they are doing is very small. And even government has taken a crop alternative program, CDP, but that is also, see, they gave first year 30 crores for 10 states, and now they are reduced to 6 crores. So for the first employment and the tobacco grain, I don't think that will be enough. So you have gone back, even the funding is gone back. So policy should be, when you start, it should be followed up, it should be continuous, then only the tobacco control, particularly supply side, can sustain. That's what I feel. And for Tenduleaf, I can say with confidence that it can be there can be alternative for them. See, they collect only in 3 months, April, May, June, and the minimum days is just 17 days to 20 days. They put up the labor, average employment. So if you take up MG Narega program during this off season, there in particularly Jharkhand, AP, Orissa, Chhattisgarh, where this Tenduleaf is collected, I think they can be provided with alternative source, because whereas they put up 20 days, whereas MG Narega gives 100 days of employment. So you can, I think that can be an alternative, and that Tenduleaf collection, the laborers can be given some compensation through the MG Narega program or employment. So this is all about our related to mainly shifting and like agriculture. And one more study, I think so, it was in a question about the BMP study, where we did try to see the impact of the COTPA and the BBMP, where they had almost stopped or banned tobacco smoking in public transport bus stops. So BMTC and also in KSRTC bus stops there, and also in Hubli Dharwad, we took up three institutes, public transport places, and tried to see what was the impact of this ban on smoking in bus stops. And we could see that we collected this. It was a non-random sample, because whoever were the passengers available in the bus stop, we tried to collect information through a checklist. And those who were cooperative, who were willing, only we collected from them. And we had given this information to the BMT officials. And we asked them how did they start this program of controlling tobacco at the bus stops. And they said that there was through the loudspeakers, they said that there is a ban and there was control. They did not employ any new staff for this program. They had a control program. So through the existing staff, bus drivers, conductors, so they tried to implement this ban on smoking in the transport area, bus stops. So we found from the passengers that it was almost 70 to 80% passengers in BMTC. They said that they found that there is a reduction in tobacco smoking in the bus stops. They could feel that. Whereas it was not so in Hubli and the KSRTC bus stop, where they did not take special measures to stop smoking in public places. Of course, COTPA is there in everywhere, but the Bangalore transport, they employed these measures to control the smoking. BMTC had separate measures to control the smoking. And they used to see every day, the night, after night duty in the morning, they saw that there were cigarette butts, and they had special vigilance through the, and we could also see that in all the three places, the awareness was higher in BMTC area, where because there was this pamphlets being distributed, and was the everyone like the awareness was, I think so, high in PMTC area, whereas other areas, although code was there, the awareness was very low. This is what, and after the completion of the study, we shared the results. And apart from that, if you see, only 3% of the people smoke in bus stands, but they smoke for 20 minutes. So that is a cause of concern. And the first year of implementation, that's in 2005, there were 600 cases that had been reported to the police. But after the implementation, there are 40 cases that were reported in a year. So I feel this is some reduction, and there is some impact of this. But still, 100% implementation was not possible for BMTC also. That means because see, there is a floating passengers, they don't know about the rules, who come from other cities, though they smoke. So that may be the reason. Whereas the regular travelers in the bus stop, they did not go for smoking. Whereas floating passengers used to smoke. So that is the reason 100% was not found in, 100% success was not found in BMTC.
Thank you, Dr. Nayantara. I'll come to you back in a minute. But yeah, so my next question is to Riddhi. And Riddhi, you worked on understanding tobacco control litigations, both at the national level and in Karnataka. Could you tell us a little bit about your work on that and the role of litigation and legal research?
Hi, Vivek. Thank you. Thank you so much for having me. Thank you to you and Dr. Pragati. So the study we did was part of rather a strand of work, and it was part of a larger project which was designed to study the role of the state and the tobacco industry in tobacco control, and was headed by Dr. Upendra Bojani. So part of our work was trying to kind of map and understand tobacco-related litigation. Now, for a little context, I think there's a lot of literature that tries to understand how the tobacco industry wields power over the state, especially in high-income countries like the US. But there's very little like evidence in the context of LMICs. So against that, this study was extremely important. So I think by doing this fine-grained analysis of litigation across various tobacco-related laws, and more specifically, for example, food laws, we're kind of exposed to the tactics the tobacco industry uses in, dismantling or stalling tobacco control, whether it was policy or laws. Because we know, for example, anecdotally, that every time there is a law, it is challenged before the court, but we don't know how the industry does this. So while mapping the litigation, we kind of realized that differential naming, for example, we know that India has highly localized forms of tobacco, and these kind of vary with, the geography and states. So what the tobacco industry would argue was that this, for example, this product does not come under the scope of this food law. That pan masala is not a tobacco, is not food, and hence cannot be regulated by the food law. So this kind of differential naming was being exploited by the industry to evade, the strict tobacco control laws that it should have been accountable for. Another tactic was the way the industry kind of pitted laws against each other. And this is extremely important because, it has takeaways for the way we can frame tobacco, laws in the future. So one argument which was very prominent was that we have a specific anti-tobacco law, that is CODPA, and hence the scope of the food law should not be used to regulate smokeless forms of tobacco like gutka and pan. And lastly was that the tobacco industry argued that there are various levels. We know that there are various levels of government, for example, the union, the state, and the municipal government, and all of them kind of leverage laws and policies differently to regulate different forms and aspects of tobacco. But the industry maintained that, the state government had this power, the central government, for example, had this power under the food regulations and not the state, and hence. So these ways of framing arguments also kind of help us to frame better laws, because, for example, the same kind of arguments, there's a modus operandi to it, and the same kind of arguments were reproduced when, for example, the e-cigarette, notifications were instituted by state. That, for example, the product could not be regulated in that context under the Drugs and Cosmetic Act. So I think this, actually deconstructing or looking at these litigations closely is really important, as it kind of helps us frame better laws for the future. Another thing is with respect to the overall governance framework. So for a country like India, which has a larger social and political context, and of course these laws operate within that context and not in a vacuum, it has strategically itself, the state also has been strategic in the way it energizes, laws across various sectors to deal with tobacco. For example, even when the food notifications that were kind of used strategically by state governments to completely ban smokeless tobacco products at a time where they were not regulated by any other law. Even when they were challenged, there were environmental provisions, for example, that were energized to kind of, when the industry found ways to circumvent that ban. So I think using these litigations to try and understand the overall, governance framework that the Indian state has kind of historically worked to regulate, different forms as well as different aspects of tobacco is very important, because it kind of tells us, as both policymakers or public health practitioners or activists, what are the laws that we can strategically kind of leverage to, make sure that the industry does not target those laws. For example, are there environmental provisions? Are there, provisions with respect to transport? Are there provisions with respect to the food law? So I think it tells us a lot about that. Then we also kind of have some understanding from this study on food laws of which level, and this is important because it also speaks to implementation, of which level of government should kind of be activated with respect to, regulating tobacco, because regulating tobacco is not a homogeneous task. And it's like, I think I was reading the paper that Dr. Pragati and you authored with respect to implementation. It's very complex, and hence, it kind of tells us for localized forms of tobacco, for example, would it be more strategic for the state or even the, municipal government to kind of have control over that domain? And then how do you harmonize all the different laws to make sure that the industry kind of doesn't say only this law can regulate and hence, escape the regulation or policy considerations? So I think one is that's what understanding litigation is a very different way of, developing empirical evidence, because it's qualitative, but it tells us a lot about, and it's also not been done before, a lot, especially in the Indian context, but it does tell us a lot about, process, a lot about stakeholders and actors, and all these things are very important to both informing and shaping the way that we kind of look at and frame tobacco control laws.
Thanks, Riddhi. In the Indian context, Riddhi, many, I mean, tobacco control advocates don't necessarily come from a legal background. They don't have the legal knowledge, not necessarily have the capacity to counter industrial claims. So, according to you, since you mentioned the importance and the growing sort of work in tobacco control research, especially looking at it from a legal perspective, how do you think sort of legal research and advocacy can help in the stronger and sort of effective implementation of the laws in India?
So yeah, thank you, Vivek. That's a really interesting question. So I think that is kind of changing. I think a lot more people are slowly being forced to be aware about laws, the concept of rights, and things like that. Because we've also seen, not only with respect to tobacco, but even COVID, the state did energize a set of laws and policies, whether it was to regulate, vaccines, or like allocation of beds, and various aspects of the pandemic. So I think that's slowly changing, but I think what's important to realize is not only legal research, but research through a public health lens is important, especially for especially for tobacco control, because I think, like you say, especially for implementation research, this analysis of litigation and legal research has a wide scope. It could be analyzing litigation, it could be understanding legal avenues or legal documents. It could also mean understanding the intention of various laws. So I think with respect to especially implementation research, it's important because it kind of helps us understand these various legal avenues. For example, we know that with respect to implementation, different kinds of stakeholders use the court differently as an institution, right? There are public spirited individuals and, for example, NGOs who go up to the court and say that we require, implementation of this law, versus the industry, which kind of uses the code differently and says this law should not be implemented because either it violates our right to trade, and so on and so forth. So both legal institutions as well as the law play a very important role in kind of informing tobacco control policy at all levels, whether it is policy design or the way policies are implemented and enforced. So I think, and that also it also helps us, for example, to frame better laws, right? Because we know that the law in bare text is very different from the actual working of the law, and implementation challenges only come to light when the law takes effect. So only if we've known that COTPA has worked a certain way for X number of years, can we actually kind of design a feedback loop to improve the working of COTPA. So in this way, and we are, for example, for what a law cannot compensate, we can also design rules and regulations to help kind of give better effect to the implementation of the law. And for that, legal research plays an extremely important role because it kind of tells us about all this nuance. So I think in that context, legal research becomes, like I said, very important.
Thanks a lot, Riddhi. And thank you to all of the panelists, Dr. Murlidhar, Dr. Nayantara. I think from a broader sort of perspective, we got to understand the different sort of sides of research. One is, sort of research that identifies, especially in the case of Dr. Murlidhar's study, where he's worked on sort of identifying the demographics of tobacco use, trying to understand dual use behavior, especially among youth and adolescents. Then research as evaluation, research to evaluate, how Dr. Nayantara has looked at research from an evaluation perspective in trying to understand the role of DMTC and how that could be a model for effective implementation, trying to evaluate sort of COTPA implementation, and also looking at research to sort of understand and preempt. In the case of Riddhi's work, where she worked on legal research to understand industry interference and how tobacco control advocates can preempt such arguments brought in by the tobacco industry in relation to the state. So I now invite and open the floor to the participants for any questions or comments. I see the chat box has a few questions, but if you'd like to sort of unmute and ask directly pointed questions, you may do so. There's one question by Venkatesh. He says, in order to capture the actual violation of COTPA Act, some surveillance mechanism in consultation with DATC was tried. It involved an app which enables capturing the violation by the people who install it and send it to DATC. However, the thrust didn't receive much support from the DC of our district that time. How does one go about it? What other district level measures could be taken? I think this is a general comment. So if anybody would like to answer that question. Yes, Dr. Mulidhar.
Yeah, as I understand, people are not utilizing the app which is there already. I think Venkatesh is referring to the Stop Tobacco app, if I'm not mistaken.
Venkatesh, do you want to come in and unmute yourself?
So just thinking aloud, what I feel is whether there can be any opportunities like involving some interested self-help groups rather than targeting the entire district population in one go. People who are working in a given district would be knowing some groups, some associations, some self-help groups, those who are passionate about tobacco control. To begin with, I would suggest Venkatesh to look out for such groups of people, and maybe by targeting with their help, the utilization of these apps can be increased. So that's my view on that.
Thanks, Dr. Muralidhar. Dr. Nayantara, have you worked in Manipur? Because there is a very specific question addressed to you. As per your research study, what is your best findings on tobacco control policies in the northeastern side, mainly in Manipur state?
Sorry, we have not done. See, Manipur and the northeastern states have high tobacco consumption and also alcohol consumption. That is this one, but we have not. See, our studies mainly was on agriculture and BD rollers and tenduli pluckers, and all three are not there in Manipur. So Manipur is mainly the consumption side. So the demand side or the COTPA, the prevention, all these studies apply there. So I know that there's high consumption, but we have not done any studies on that. I don't find any NGOs also in tobacco MPC side. There are 63 NGOs. I don't know if somebody is working on Manipur or something, but because of the cultural aspect, from the beginning they have high consumption. That's all I know, sir. But I don't know. Sorry, I've not done it.
Dr. Nayantara, just to follow up with what you mentioned before, a lot of debate, both in sort of research and even outside in policy spaces, is this tension between livelihood and health. On one hand, you have, implementation of COTPA because you have arguments around health saying that tobacco is, injurious to health and it causes cancer. But on the other end of the spectrum, you also have the economic livelihood questions of
there is some disturbance
of leaf and BD industry. Hello.
Yes. No, okay. There are some disturbance. Okay.
Yeah. Sorry. So I'll repeat my question. Is that there's a lot of debate on the economic aspects and livelihood aspects of tobacco. versus the health sort of arguments around tobacco. How has your research tried to grapple with this debate? Because
Yes.
on one hand you have tobacco, on one hand you have the health aspects that say that tobacco is injurious to health and causes cancer, but on the other side of the spectrum you have the economic
Yes, yes.
livelihood
Yes, I know.
aspects.
That's
So
what I
how?
said in the beginning. That's when we did studies this, we made a rough estimates of tobacco dependent employment. So every time the NGOs, the tobacco control activities, they go to the government always says that there is a problem with the farmers. The question of livelihood of farmers, BD rollers, Tenduli pluckers always comes in between. So this is happening since CODPA is being implemented from almost 2 decades. And now the researchers, not just CMDR study, but there are many researchers and even the government, Central Tobacco Research Institute have shown that the Agriculture Ministry has sponsored a study on behalf of government. So all these studies have shown that there are alternatives, except in some few places. But still, that is not being taken, means government is not taking major action on that supply side control. Only because of that. That's what I told. We have already made a rough estimate. Where is, they say 46 million dependent employment, whereas we say there are 7.5 million dependent employment. So I think so we have given this to the government through the whatever sponsors or the WHO study also. So I think the estimates again, somebody has to look into this. And this is the main problem. Always this question of dependent employment comes in. So that is the reason we have showed that the dependent employment is less and the farmers can be shifted because there are only around 4 lakh farmers all over India. I can bet on this. I can with confidence say that there are only 4 lakh farmers, whereas the previous estimates say there are around 6 million farmers. So that is not possible. And almost 20 million laborers. How can that be possible only when the area itself is just 4 lakh hectares? So one needs to think rationally. How can this be possible? So that is how we have been convincing government. When we have been all our studies we are discussing with the government, that has been shared with the government. So I think so. And also one point I wanted to make is here. So the studies show that demand side consumption has gone down by I think so 1% reduction or something. But still here also there is I have a doubt, or maybe I don't know. I feel assumed like if the consumption has gone down, then where does the production go? Production has not reduced. The area under tobacco has not reduced. Production remains almost 8 million tons of tobacco, million cases of tobacco. So where does it go? The exports have reduced. Then where does this tobacco which is produced in the country go? So it is here only in the country itself. So it is being consumed here. So there may be shift from smoking to gutka or chewing tobacco. But I feel this also needs to be investigated.
Thanks, Dr. Nayantara. Upen, do you want to come in?
Well, just to reiterate, I think what Professor Nayantara was highlighting, I think to me also, it seems that this very framing of livelihood versus tobacco control is very, very problematic. I don't think public health folks have ever done this, because as public health people, those who are concerned about tobacco related harms, and that's why want to do tobacco control and want to reduce tobacco harm, are also as well concerned about livelihoods, because occupation, livelihoods, incomes are some of the basic determinants of health. So we cannot be sort of enemy of taking away people's livelihood. I think this debate has particularly been framed this way over time by tobacco industry. Because that benefits the industry particularly, not even all the time workers. Because many times, if you see, there are some announced engagements with tobacco farmers, with BD workers. We just published a paper last week out of our work, participatory work with BD workers in Tamil Nadu. I have seen similar accounts earlier. What you see is that many workers are very well aware of certain problems. It's not that everybody is there by choice, and they also see a longer term uncertainty around tobacco. It's that industry paints everything in just a black and white debate. just like how Professor Naintara highlighted, I think in doing these narratives, there are also many falsehoods, including this exaggeration of a number of tobacco-dependent livelihoods. And like she said, I think you should refer to her wonderful paper in EPW. I think it was in EPW research notes, if I recollect, that she actually highlights this contrast between what industry claims to be tobacco-dependent livelihoods and what she painfully gathers from various government reliable sources, and so how exaggerated the tobacco industry claims are. Similarly, beyond the exaggerating numbers, industry has also often what you may call homogenized workers' views. It is not that homogenized. I mean, in Karnataka, engagement with some of the farmers groups have highlighted how they are actually keen to move out, but for that they need various supports, right? Be it subsidies, be it other things. Now, so ultimately, the ball should fall in the government's court rather than all the time highlighting them as contrasting things as against what public health folks are demanding. Unfortunately, I think government has moved a very slow pace in terms of providing better, safer alternative livelihoods. And I don't know if it will pick up the pace unless we as public health advocates or tobacco control advocates also treat livelihood as an important aspect and not just stick to some of the core areas of taxation and other things, given that we are such a large tobacco producer country. Also, governments have other direct investments in tobacco sector. So there is also some fundamental level of conflict of interest within government. So it's not that easy. I think governments also is probably sorting out what should be their overall sort of stand, because there are a lot of policy divergence. So I think at least we ought to be careful in not framing them as opposites, because that's the classic framing that the tobacco industry has been propagating for a while now. Thank you.
Thanks, Upen. Or anybody else would like to ask questions, comments?
Vivek, I have a point to make here.
Yes.
With regard to what all developments that have happened and the kind of taking stance contrary to the existing views has made would make situations more acrid. Given the way the approach the industry has approached in a more slithering and the tactical view, we might have to go in the same pathway in the opposite direction. Having said the opposite direction, not exactly directly, I mean, we can, it's just like to give a metaphorical example, sympathetic and parasympathetic actions, what we have in our body. So something like that we have to do. We have to look at how industry is starting and what pathway it is trying to take to safeguard its interests and put the build-up narratives to put its case of livelihood and then defend it.
Thanks, Venkatesh.
Yeah.
Any other questions or comments?
Vivek,
Yeah.
there is time. No, I think a lot of discussion is going on with respect to livelihood, alternate livelihood. I'd like to share the findings from our study, wherein we had done a study among BD rollers in Udupi district. And we were told by the BD rollers that there is skill development schemes which are available, but then those things are happening only at the district headquarters. People in any remote village have to come over to the district headquarters. So that was one of the barriers which these BD rollers were facing. Second thing, although they wanted to shift, they are getting so many benefits from the government side itself because they are part of BD welfare fund or something is there, wherein there are dispensaries in Udupi district. There are 3 dispensaries which cater to exclusively for BD rollers, and scholarship for their children if they join medicine or engineering course, and a lot of health care services which are done free of cost, even in tertiary, best of tertiary care centers for the BD workers. Where when we are trying to shift them from the BD rolling occupation to the other thing, we also need to think over how to wean off these kind of benefits what they are getting. So I just wanted to make this observation what we had observed, got it in our study.
Thanks, Dr. Muralidhar.
Can I add to this?
Yes.
So what Dr. Muralidharan said may be right, because sometime back when there's some reduction, because due to GST, the factories or the BD firms, they started like again desegregating and giving it outsourcing again to somewhere else with different names. So there are some short-term employment loss to BD workers, particularly in Dakshin Kannada district and Udupi. And there were a lot of vegetation from the BD rollers. So they went and said on strike saying that we want job, we want BD rolling. So even if you ask them without alternative, if you just ask them to give up BD tobacco, so they would be going, means they need that job. As you said, there are benefits and there is some income from them where they can do it at home sitting. So they went on strike demanding work from BD industries. So this is what is the real means at the local level. This is the problem. Or the reality, you can say.
Yes, ma'am. I mean, very rightly said. I think further research is required, which can explore the opportunities to circumvent these issues and how to sort out this problem. Thank you, ma'am, for that.
Thanks, Dr. Muralidhar and Dr. Nayantara. I see a lot of conversation happening on the chat box, particularly on Article 5.3. Pragati, Riddhi, do you want to come in, perhaps in just brief?
Thanks, Vivek. No, I mean, side conversation about how ITC is collaborating with IIT for STEM researchers. So yeah, on one side, there is all these issues that we see on ground related to implementation, and also the ones related to alternative farming and livelihoods. And on the other hand is the industry, which is still trying to permeate through different avenues wherever possible. So the conversation was just going on, like how do we, would 5.3 be applicable to them, and how do we counter such instances? But yeah, thanks to all the speakers for sharing from their empirical work and for the rich discussions.
Thanks, Pragati. If we don't have any questions or comments, we can end the webinar. It's 4 p.m. I'll just wait for another minute more. Okay, so on behalf of Anusthana Project and the Institute of Public Health, I would like to thank Dr. Muralidhar, Dr. Nayantara, and also Riddhi for their time and also for their expertise in research, sharing their contextual sort of the work that they've done, and for bringing together a rich discussion, as Pragati mentioned, on trying to understand the role and contributions of research and how it continues to shape tobacco control policies in India. We thank all the participants who've joined, and please stay in touch to know more about Project Anusthana and our work at IPH in general. You can check our website at iphindia.org. Yes, stay tuned and see you for the next Inside Implementation episode. Thank you.